I am going to be talking about the achievement gap today. And there's lots of different programs and innovations that have been attempted to try to close the achievement gap. Different standards and accountability, different kinds of financing, teacher preparation programs, rigorous curricula, charter schools. But no matter what kind of standards we have, no matter how much money we spend, no matter how effectively teachers can teach, or how good our curricula are, or what kind of schools we have, these efforts are going to be compromised if the students are not motivated and able to learn. And what I've found is that there's certain kinds of health problems that affect children's motivation and ability to learn. This next slide is a simple slide, but I think it's a really important one. And what it shows is that there's these interconnections between health, education, and social economic factors. So we have these three problems that are interrelated in causal ways. But the solutions that we've had up till now have been very siloed. So we have interrelated problems that have been addressed through categorical or siloed solutions. I'm going to just focus on trying to delimit the scope of what I'm going to talk about today. I'm going to only focus on urban minority youth from low-income communities. That's not to say that there are not youth from other areas, rural communities that have other important needs. There certainly are. It's just the literature is kind of delimited. I'm going to only focus on school-age youth. It seems pretty clear that an even more important population would be a preschool population, because we know that in those early years of birth to age 5, even more important brain development and learning potential that occurs there. And I'm going to only focus on problems that can be feasibly and effectively addressed through schools. So the first part of my talk is going to be on health factors that affect educational outcomes, and then the second part is on effective and efficient school health programs. So I used 3 criteria to identify health problems that seem to warrant an important focus with respect to educational outcomes. And those criteria were the prevalence and disparities of problems, the evidence, actually empirical evidence that these health problems causally affected educational outcomes, and then that they could be addressed in schools. And based on those criteria, I identified these 7 factors: vision, asthma, teen pregnancy, aggression and violence, physical activity, breakfast, and ADHD. All of these problems are highly prevalent. For example, vision problems are affect about an estimated 1 in 5 youth in this population. Asthma is the most common chronic disease affecting youth. That's about 10 million individuals under the age of 18. That's about 14% of that population. Teen pregnancy affects a staggering 1 in 3 female teens is expected to become pregnant during her teen years. That's a staggering statistic. 28% of adolescents report being bullied at school. 2 in 3 don't get enough physical activity. 1 in 5 skip breakfast on any given day. And ADHD is the most common mental and behavior disorder affecting young people, affecting about 8% of school-age youth. That's about 4.6 million individuals throughout the nation. Now, while these are all highly prevalent problems, each of them also greatly disproportionately affects urban minority youth. Here, this first slide is on visual impairment, shows the rates for blacks and Hispanic youth are much higher than whites, as is the rates for low-income populations. This next slide talks about asthma prevalence, and we can show that compared with whites, the prevalence for asthma is about 45% higher. And this slide also shows the importance of disentangling the Hispanic population, where the rates for those of Mexican origin with respect to asthma are actually relatively low. in contrast to those from the Caribbean. Now, asthma per se is not a problem. What's a problem is poorly controlled asthma. And you'd see these same disparities if you looked at indicators of poor control, like overuse of emergency rooms and underuse of efficacious medications. The rates for teen births are 3 times higher for blacks compared with whites and 4 times higher for Hispanics compared with whites. And here you see fighting, physical fighting. This is in-school physical fighting. Again, you see these disparities in rates by ethnic, cultural background, racial background. And this next slide shows, these are all based on national data, by the way. All these slides I've shown so far are based on national estimates. This particular one is from the Youth Risk Behavior Survey, a biennial survey conducted by the U.S. Centers for Disease Control. Shows that one of the questions is asked in a probability sample of high school students is, how many of you have missed 1 or more days in the last month because you were afraid to be at school or travel to and from school? And here you see that, you know, while 4% of whites answered yes, they did at least one of those days, 6.6% of blacks and almost 1 out of 10 Hispanic students answered that question. Here we see the percentage of female high school students who did not participate in physical activity. And again, the rates are much higher, particularly for black females. And this is breakfast consumption. You see that at age 9, there's differences between whites and blacks who consume breakfast on the 3 days preceding the survey versus at age 19. Well, we see a difference in the absolute difference from age 9 to 19. Actually, the relative difference increases over time. And then this last slide shows the rates of ADHD, which tends to be higher among children in single mother head of households and those with lower income. So everything I've said up till now is really old news. These disparities, these problems have existed for a long time. So we're very good at documenting the extent of the problem. This next topic, though, is relatively new and largely based on research conducted in the past 10 to maybe 15 years. And that is, how and why do these health problems affect educational outcomes? And through the literature, I've identified 5 distinct causal pathways through which these problems affect educational outcomes. And they're sensory perceptions, cognition, connectedness and engagement with school, absenteeism, and dropout. Now, these are things that educators care about. Sensory perceptions are just being able to see well and hear well, and that's obviously important to learning. Cognition has to do with your cognitive functioning, your memory, your alertness, your ability to solve problems, make decisions, carry out sequenced actions. One of the things that's least well known, or at least well documented until recently, is the importance of connectedness and engagement in school. And what does that mean? It means that the extent to which people in school feel like there's other students and their peers and the adults in the school care about them as people, as well as learners, that they feel like this is some place where they belong. It's a sense of community. And then obviously if students are absent or drop out from school, they miss important opportunities for learning. So every one of these pathways is affected by more than one of the health problems I identified. So visual problems. Now, the main kind of visual problems affecting youth are just refractive errors. Refractive errors are the kinds of visual problems that require glasses to correct them. And a major problem is hyperopia. Hyperopia is not being able to see clearly at near distance. And what we find is that many youth from poor communities will fail a vision screening, but they'll not get a subsequent eye exam or glasses. Now imagine you're trying to learn how to read, but now all the letters are, first of all, hard enough to distinguish as it is between P's and B's and D's and Q's, but now it's all blurry. Very very challenging. Also, children with ADHD seem to have problems with perception, not only more visual problems, but also the perception of time. The perception of time is important in completing sequenced actions, like solving a mathematical problem or writing a story, like first, then, finally, things that might seem simple to you. The next pathway is on cognition, and what you can see is cognition is affected by 6 of the 7 factors that I identified. Visual problems affect cognition now not because of sensory perception, but because of visual motor integration, the connection between your eyes and your brain. And that would be important, for example, in seeing something up on the blackboard and then interpreting it and being able to write it down in your notes. And we know that note-taking is actually quite important in academic performance, not only in elementary and secondary school, but in college as well. How does asthma affect cognition? Well, the way asthma affects cognition, and again, it's not asthma, it's poorly controlled asthma. The main way that asthma affects cognition is because children with poorly controlled asthma have disruption in sleep. And only the last 10 years or so, the importance of sleep has been recognized by neurosciences, and how sleep affects our brain function, our brain chemistry, our ability to concentrate has been very well documented. I know quite a bit about sleep deprivation. I have 6 children. And you can tell that when you don't have a good night's sleep, night after night after night, that's going to affect your ability to think and pay attention and do well in school. And children with poorly controlled asthma have a harder time staying asleep, falling asleep, and harder time staying asleep. Aggression and violence affects cognition because if you're going to school in an environment characterized by bullying behavior and hostility in a place where you're not really comfortable, it's harder to concentrate. Not only is it harder to concentrate, you're more likely to have intrusive thoughts and be distracted. And of course, aggression and violence disrupts teaching and learning behavior for all students, and it's a major problem in the nation's urban public schools. Now, I know one of the things that you're most interested in is physical activity, and physical activity is an extremely powerful determinant of cognitive ability. I guess most of you weren't here at this last lecture, but the whole last lecture was devoted to the important effects that physical activity has on brain chemistry and neurotransmitters and uptake of neuronal factors and how important that is. And the Greeks kind of knew that 4,000 years ago, but it's really only the last 10 or 15 years that the neuroscientists and molecular biologists have demonstrated it empirically and shown exactly which neurotransmitters and neuronal factors are affected. And it's a very, very important factor. The other determinant up here is on breakfast. And breakfast has been shown to be associated with better performance in school, greater alertness, better memory. And it's not surprising that principals send home a note on the day before the test to make sure your child eats a good breakfast the next day. Well, it's probably a really good idea on the other 179 days of the year as well. If we're trying to promote learning, then just promote test performance. And then, by definition, inattention and hyperactivity really is associated with, inability to focus attention and concentrate. Likewise, 5 of these 7 factors have direct and powerful effects on connectedness with school. So how does visual problems affect connectedness and engagement with school? So imagine a little 6-year-old person and they're trying to learn how to read, but no matter how hard they try, they can't succeed. What's going to happen? They're going to become demoralized. They're going to become disengaged, and they're going to become less connected to school because it doesn't matter. They keep trying and trying and trying their hardest, and they keep failing. So if you wear glasses, you can relate to that. If you take your glasses away, you realize it's hard. It's going to be really a struggle for you. If you don't, you might have a harder time relating from it, but you can imagine what it would be like. Likewise, children with asthma often have more anxiety about being in school. They might be afraid if they have an asthma attack in the school, you know, is somebody going to know how to deal with it? They tend to have much greater concern, much less likely involvement in school activities. You would think if you go to a school that has a lot of aggression and violence, and you're reading hate words and graffiti in the bathrooms, and you're getting pushed in the staircases, and you know, most of the bullying behavior is not going on where teachers can see that. I'm sure many of you have experienced it or know people who've experienced it. It's not the kind of place where you're going to want to be. In fact, it's going to be the kind of place where you're going to want to get away from. So if you're in an environment characterized by hostility, it's not going to be the kind of place that's cultivating connectedness. And what we find is that when students are connected in school, they're much more likely to succeed in school. Physical activity. We often think of physical activity programs as promoting physical fitness. And yes, physical fitness is very important. But it's so much more than that. The potential for physical activity programs is so much more than that. Physical activity programs, if they're done really well, can really foster teamwork. They can foster cooperation. They can teach young people how to win, how to lose, how to deal with failure. They can teach them how to get along. They can help build community and connectedness in schools. And unfortunately, too often physical activity programs really are oriented toward the kids who are most athletic to begin with. And that's a very small percentage of the kids, rather than the kids who are least athletic. And physical activity programs really need to focus on really opportunities for all the young people in the school, not the ones that have the greatest athletic ability. One of the things I learned that I thought was most devastating as I got into this research is that children with ADHD, they don't have any friends. Nobody wants to be their friends. They have a hard time making friends with peers, and they have a lot of conflict with adults as well. So they tend to be much less connected in school. Likewise, 5 of these 7 factors tend to be associated with absenteeism. And again, all of these simple slides I'm putting up there is all like documented through extensive empirical evidence that's published in the scientific literature cataloged in the National Library of Medicine. So children with asthma are absent more. It's not controversial. If you have poorly controlled asthma, you're going to miss more school. You're going to be late for school more. You showed the slide. If you go to a school characterized by aggression and violence, you're going to be afraid to go to school. You're going to be less likely to want to attend. Physical activity and breakfast both promote better health overall, and you're less likely to become sick. Breakfast programs in particular, especially in these days, can help kids get to school on time. Eating breakfast and lunch in the school might be the only really full meals that children are getting in some families. And children with ADHD are absent more. And then finally, with respect to dropping out from school, it's pretty well known that teen pregnancy is highly associated with dropping out of school, as is ADHD. Children with ADHD are much less likely to complete high school and attend college. So what can schools do? Well, you know, vision screening is pretty pervasive in the nation's schools. Unfortunately, there's not a lot of outreach to parents and teachers or on-site provision of classes. I mean, it probably makes sense to just, you know, if somebody fails a vision screening, on the spot, do the exam. If they need glasses, give them a pair of glasses. In fact, you better give them 2, because little kids are going to lose their glasses and they're going to break their glasses. But you know how much it costs to make a pair of glasses? Probably about $12. You know, so it's really we have in epidemiology, one of the main ways you evaluate screening programs, it uses 3 criteria: reliability, validity, and yield. And the yield is the extent to which you identify and bring to treatment, you know, the undiagnosed problem. Well, here we have very ineffective vision screening because we're identifying problems, but we're not bringing it to treatment by getting kids glasses they need. With asthma, you know, there's programs in place for better case management, elimination of environmental triggers, like whether that be pets in the classroom or cleaning solvents that are used in the school or different things like that, education for students with asthma, and very importantly, safe opportunities for physical activity. A lot of times children with asthma will avoid physical activity when it's really important for them to have those physical activity opportunities. Teen pregnancy programs can be addressed through skills-based sex education programs and social-emotional learning programs, as well as contraceptive services for sexually active youth, which by and large are not available in the nation's schools, nor are services for teen moms to help them complete school if they become pregnant. It's not controversial. Violence prevention programs work. All different kinds of violence prevention programs work. What we need is school leaders to make this a priority, and by and large it's not been a priority. And then, you know, there's some dramatic thing that occurs that gets tremendous media attention, like a shooting in a school or something like that, but the extent to which aggression and violence and bullying is pervasive in the nation's schools is the real underlying problem that warrants attention and doesn't have it. Physical activity programs need to be standards-based, have recess, which we're losing. In-class movement's been found to be effective in promoting attention. Intramural and after-school programs and support for walking and biking to school. And with respect to breakfast, a lot of schools have breakfast programs, but the participation in these breakfast programs is much lower than in the lunch programs. So one way that can be increased is through allowing students to eat in the classroom, which has been shown to be an effective strategy. And with respect to ADHD, you know, teachers are often the first person to identify ADHD because they have the social referent with the other children. And a lot of the ADHD interventions focus on making the children easier to deal with for other adults. So it's controlling the symptoms, but they don't really focus on helping the children succeed academically and socially. And some of these kinds of interventions that focus on academic tutoring and behavioral interventions can be quite helpful. In some places, what they do is they just put the child's desk really close to the teacher's desk, so the teacher can reach out and, you know, help that child when they need a little control. So, you know, if a student can't see very well, if their eyes don't connect with their brain, no matter how well a teacher can teach, it's not likely that they're going to have an easy time acquiring academic skills. If a child is having a hard time falling asleep at night, can't stay asleep at night, is afraid that they you know, might have an attack at school and nobody's going to know what to do. This is incredibly scary, having a shortness of breath, not being able to breathe. That's a scary experience. How are you going to concentrate when you're trying to learn things in school? If you become pregnant and there's no resources to help you get through that pregnancy, or better yet, really prevent that unintended pregnancy, then it's going to have an adverse effect on academic achievement and educational attainment. If you go to a school that's characterized by bullying behavior, where people are not nice to one another, where people don't care about one another, where the teachers are nasty to the students, and you know, that's not going to be the kind of environment where you're going to feel like you really belong, where you want to be. And that's going to adversely affect the sense of community, and the community in turn is going to affect how supportive people are of one another and foster cooperative learning and help people do well in school. If you go to a school where the students are not physically active, where they're sedentary, where they're ill-nourished, then it's not going to be helpful in cognition and connectedness and helping them succeed in school. And finally, if you go to a school where students can't pay attention, they're too hyper, they can't sit still, it's going to make it very hard for them to learn. Now, this next slide is probably the most important slide in the set of things, because unfortunately, the way our whole research infrastructure has dealt with these health problems has been in a very categorical way. So we have our researchers and our policies and our programs on asthma. And then we have our ones on sex education. And then we have our ones on violence prevention. Then we have our breakfast people and the USDA people. And then we have our physical activity folks. But you know what? A lot of the children affected by one problem are also affected by other problems at the same time. So there's a need to address these problems in a collective way, because these problems not only have individual effects, they have what's called synergistic effects. And while physical activity is incredibly important, and I'm a giant fan of the importance of physical activity and physical activity programs in school. If we only address physical activity and we don't address dietary factors and we don't address sleep factors, these problems interact with one another and have synergistic effects, and we may not get the benefits that we otherwise could. So school health programs must focus on multiple problems simultaneously. So it's a pretty bleak picture so far, but really not, because schools can have a tremendous influence on these factors. In recent years, there's been increasing attention and recognition about the importance of these factors in schools. The Association for Supervision and Curriculum Development, the major professional organization for school leaders, has recognized the importance of health factors on educational outcomes. The school boards associations are recognizing it. This bolder approach recognize the importance of these factors. Parent associations, different groups are more and more people in the field that see these things really understand. They recognize that while we're focusing a lot on the inputs, we need to pay more attention on the students and the factors affecting the students' motivation and ability to learn. But by and large, if you look at the school health programs in the United States, what you see is there's not sufficient investment, that the programs are not strategically planned, that they're not high quality, and that they're not effectively coordinated. So I'm going to talk briefly about each of those three things: strategic planning, high quality, and effective coordination. So what does strategic planning mean? It means that you have a set of factors that are addressed. Now, you can argue with me about the 7 things I identified. That's a distraction. It doesn't have to be those specific 7 things. It could be other things. The idea is that you identify a set of things and you address those things collectively in a strategic way. I would say that it makes sense for that the problems that are selected are problems that focus on educational outcomes, because that's what schools have the primary responsibility for. I personally think that schools should address the overall healthy development of youth. But by and large, if you look at schools and school leaders, they say, well, we're struggling to achieve our primary mission of academic achievement, and we can show that these factors have strong effects on academic achievement. So there may be a need for school-specific priorities. It has to be an ongoing process. It's not something like a fad. It really has to become a fundamental mission of the school, that this is not something that's marginalized and, okay, well, we'll do this if we have time for it. It's not going to work for that. And then, there's a need to involve the community. There's a lot of resources in the community. You need to get involvement from parents, and that's what makes a strategic approach. Now, another factor is quality, and it's an ironic thing with quality. Some of the most widely implemented school health programs in the United States are programs that have no evidence of effectiveness. I paused there for emphasis. Yeah. That's an important observation, because what it tells us is that school leaders are not necessarily making decisions about which programs to adopt based on evidence. Instead, they may be making those decisions based on ideology, based on values, based on politics. But there are many programs that have evidence of effectiveness. These are illustrations from the Centers for Disease Control, National Standards for Physical Education, National Health Education Standards. There are others from the Centers for Disease Control, and here's another example from the Substance Abuse and Mental Health Administration's National Registry of Evidence-Based Programs. So there are many programs that are high-quality programs that do exist. But it may not be so easy for people in schools to identify, well, what are those programs? Where are they? How much do they cost? How much time do they take? But that's really what's necessary. There's no point in using programs that are not going to have any value. That's a waste of money, a waste of time. I think one of the most challenging aspects of having an effective program is this notion of coordination. And coordination means different people are playing different roles, but they're all working toward a common goal. It's kind of like having an orchestra or a band. You need somebody to be the conductor, to know, okay, there's different players in here playing different roles, but it's going to all come together into a cohesive piece of music. It's the same thing. And there's a need for a school health coordinator, somebody who has the big picture in mind. The state of Tennessee is the only state in the United States so far that has legislated having a coordinator in every one of their school districts. And I think they're a leader in the United States and have had quite good results, which you can read about if you Google them if you have any interest in that. But to give you perspective, in the entire state of Tennessee, there's not as many school children attending public schools as there are in New York City. Okay? So New York City is the largest urban school district in the United States with about 1 million students in the public school system. The other thing that's been found to be effective is school health council or school health committee. And that is having a committee with representation from the school leaders, from the school board, from teachers, obviously. It's ideal to have even students involved in that so that you can have this group that's perhaps staffed by the school health coordinator, and they say, okay, what's our program going to be, and what's working well, and what do we need to do more of, and what do we need to do less of, and is the violence and bullying decreasing, is it increasing, who's buying into this, who's not buying into this, what do we need to, what's our plan, how are we doing well, do we have administrative support, where do we need more training, you know, there's all kinds of issues that come up, and then to have better linkages, because there's a lot of community resources out there. It wouldn't be that hard to find resources within the community to buy a pair of glasses for every young child that needs one. I'm sure you could do that in almost every community in the country. And there's lots of foundations. So there's a lot of money that's already being spent in inefficient ways. And we could do a much better job with the resources we already have. And then to integrate programs. You know, we have to we can't have time for all these individual programs. A lot of the programs have these underlying factors that are related to what's called social and emotional skills. They're related to skills in making decisions, skills in dealing with social pressures, skills in regulating emotional responses. And the programs exist to help young people learn these skills, and they're very helpful, not only in school but in life as well. And then there is a need to coordinate services for individual students. So think about it. So you have the health department come in and do a vision screening. So now what happens, I failed the vision screening test, a note gets sent home to the parents. The parents have to take the child to an optometrist or ophthalmologist for an eye exam. So okay, now let's say that we're lucky enough that happens. Now the child gets glasses. Now the teacher has to make sure that the child's using the glasses in the classroom as prescribed. So it's easy to see how that can break down at any point along the way, and there's a need for somebody to have the big picture and coordinating the services for those individual children. So unfortunately, as I said at the outset, a lot of times the way we address these problems are through silos. You know, our whole infrastructure is very siloed. You look at the federal government, you see the Department of Health and Human Services, then you have all these social services, and then you have the Department of Ed. And they're all competing for the same pie of money. Okay, they're all competing for resources, and there tends to be not enough interrelationships and collaboration between these different silos. You see the same exact thing at the state level and at the local level. Health and education tend to be very siloed, even though they are very interrelated. It's not a coincidence that the same youth who are persistently failing in school have the greatest health disparities. The Centers for Disease Control has developed this coordinated approach to school health, and some school systems have used that, and that's a great example of coordination of services. Now, this is a lot to ask of schools, and a lot of times schools are reluctant. They say, how are we going to do all this on top of everything else we're going to do? And I should have said at the outset, is it really fair to expect that schools are the social institution that can be responsible for all these problems? I mean, what about the families? What about communities? What about churches? What about governmental agencies? I mean, aren't schools charged with enough things? The sad truth is that schools are probably the strongest social institution to do this work. And let's face it, this is where young people spend the majority of their day. And let's face it, if we don't do this work in the schools, it's going to really impede other efforts in schools to try to promote academic achievement. So it's not really, I don't mean to give the impression that they should be solely responsible. There's a need for commitment and involvement from all these other social institutions. But schools clearly have a role to play and probably can be one of the most influential factors influencing the lives of youth, because that's where they spend their time. So what do we need? We need support regarding these different kinds of efforts. One thing is just communication. So, you know, if you have a school leader who's willing to take a stand on this, this can be incredibly important to take a stand on this and just speak up about the importance of health factors affecting academic achievement. By and large, you know, you're not going to see any real effects until you see policy mandates and accountability. Well, you take a test in math, you take a test in English, you take a test in science. Do you take a test in health? No. Oh, must not be very important then. So ultimately, until there's that kind of accountability, you're not going to see any real recognition. Policy mandates. Some cities, like Chicago, has recently instituted the need for including health-related goals in all their annual school improvement plans. And that's been shown to be quite an effective strategy. Financial support is always important. Providing guidance, technical assistance, and professional development. That is to help, you know, they have within federal agencies, state agencies, you have teams of people. You have nurses. You have mental health professionals. You have curriculum specialists that can help schools with this. And then there's a need for certain kinds of data collection and research. Now, the U.S. Department of Education has never really paid that much attention to any of these issues. They spend a tiny proportion of their budget on these issues. But they've identified these 4 priorities: distribution of effective teachers, focusing on the lowest performing schools, improving data systems and assessments and standards. So, you know, to what extent are these issues related to highly effective teaching? Well, you think most teachers can deal with the behavior management problems in their classroom? Do you think teachers should know how to identify a child who's having vision problems? How about, does a teacher know how to prevent bullying in their classroom and talk about building connectedness and community in their classroom? What makes for a highly effective teacher? If you looked at the lowest performing schools in the United States, and that's about 5,000 schools we're talking about, guess what? Those would be the exact same localities where you'd find the greatest health disparities. And that is not a coincidence. It's also the place where you'd find the highest rates of poverty. So these are the same exact schools, and you're not going to focus on turning around these low-performing schools through curricular innovations, through data systems, through charter schools, unless you address these problems that affect motivation and ability to learn. Improving data systems. Well, we have a lot of data systems in the U.S., but very few of them are related to connecting. We don't have anything that tells you the school climate in the nation's schools. So if we don't collect those data, it must not be very important. And likewise, with respect to assessments and standards, you know, the Department of Education, by and large, hasn't really, you know, had much of an emphasis on this. So you know, we have a public health plan in the United States called Healthy People 2020. We've had it since 1980, but we've never had a school health strategic plan. We don't have any incentive for people to get involved in this area. There's much more money for chronic disease and using the medical model, which is driven by pharma and the big healthcare industry, rather than, you know, not big enough advocacy group for the young people in the United States, the children in the United States, human capital programs to help people go into this field, to integrate school climate and connectedness into our data collection systems, and integrate health-related research into the ed research agenda. With respect to policy, I'm not going to go on and on about this, just a couple of examples. Integrating health-related measures into school improvement plans is one thing, establishing school health councils, ensuring that there's enough time in the curriculum to have some time at least for health ed curriculum, and providing professional development for staff. Have some effort. Unfortunately, the colleges of education, by and large, have not trained teachers or school leaders how to address any of these issues. So there's a need for professional development, in-service professional development, and supporting learning communities to help people learn from one another, identify best practices, and train school health coordinators for urban school systems to implement these kinds of programs. Now, I'm a researcher. I've garnered about $20 million in research, largely from the National Institutes of Health over the 3 decades I've been at Columbia. And what I can tell you is the kind of research that we need now is figuring out how to put into practice what we already know. And that's not the kind of research that's by and large being done. It's not the kind of research related to translating what we know into practice. That's exactly what we need. Instead, you know, we have very little research on what are the motivations and skills of school leaders and teachers, and what kinds of evidence is valued by legislators to help them support these kinds of programs. And, you know, to what extent can we include educational outcomes and key measures of health interventions? See, we never think of education as a health outcome, but it is, because people with highest levels of education are the most healthy. And it goes the other way around too. We never think of health as a benefit of education, but the people who have the highest levels of educational attainment are also the most healthy. So making the connections between these factors. Now, I'm at a college of education, and I can tell you I've been fighting with the people for about the past 30 years in curriculum and teaching and educational administration to try to influence their curriculum. And part of the reason that there's not more activity in the nation's schools is because the way that school teachers and school leaders are being prepared has not really emphasized these factors in a sufficient way. And it's been a struggle. It's only the last couple years things are starting to change. But colleges of education, like your own, have a tremendously important role to play in shaping the health of the nation's youth. To integrate these kinds of programs into the professional preparation programs of school teachers and school leaders, to form school and university partnerships, and to lead efforts to develop and implement different research and development efforts. So that kind of sums up everything I typically say about this, and I thank you for your attention.